let's understand, before 1980, hysteria was a diagnosable condition and it was exclusively diagnosed in women, right? And that was the entire premise on which the entire debate started, that if men are showing similar symptoms, they are not diagnosed, but women are. Well, long way back, possibly hysteria comes, basically means uterus. So it was understood that uterus, the one who has uterus will have hysteria. So women do have the uterus and they will have hysteria. So a lot of, so it was the medical model which was explaining a lot of times that why are women behaving in bizarre way, why are they losing control, why are they so frustrated, why are they not following the norms. So anyone who would not align with those kind of gender stereotypes would be categorized as hysterical for that matter. Freud has worked a lot on this as well, as we know. It's a very famous psychoanalyst for that matter. So a lot of time it was seen as a biological condition where this uterus was the culprit and something has to be done about it. But now over the period of time it's been realized that now hysteria is called as conversion disorder. It's diagnosed in women, it's diagnosed in men, and it can also be diagnosed in children for that matter. Now what happens here basically is where your sensory, motor, and your cognitive functions, everything gets involved. Okay, so hysteria now, which is called as conversion disorder. The signs and symptoms are primarily, involuntary movements of your hands, of your feet. They could be jerky movements, which could look like even epilepsy in a lot of cases. They could be rolling of eyes in some cases. But then there would be no biting of the tongue, there would be no injuries to you. There could be sudden fall sometimes, but again the patient is not hurt as much. There could be breathlessness, there could be changing of voices sometimes when talking, there could be sudden laughter, there could be sudden crying for that matter. So all these symptoms could be suggesting that we are looking at a conversion disorder. The causes are primarily psychological, because we only diagnose it when all other tests are done and there is no organicity in the body or in the brain for that matter. And most of the time it's been found that these patients are depressed. They are dealing with some chronic stressors at home. With women it could be something like discord with the mother-in-law. It could be something like somebody who's not able to conceive and has the pressure of conceiving. And they can't voice it up. They have to go through a lot of treatment. They have to go through a lot of trauma by listening to people for that matter, and they're treated really badly. So a lot of these factors can come into the play. Children also can have these kind of symptoms for that matter, wherein they are not able to express themselves, and henceforth they will be showing these kind of signs to us again there. So now of course conversion disorder is seen in men, women and children, but mostly it's common in women and in children, and more so where the psychological expressions and and the support is not available to these people. That's when it happens. So the treatment would be primarily with with psychiatric medication and with psychotherapies, so that they find better ways to cope with the stressor, and they are better they can communicate it better, and then the family also can be educated by the experts as to what is leading to these kind of situations for that matter. Well, slowly and gradually you have to understand that this is a condition, again it's a psychiatric condition and it needs the treatment for that matter. All you can do is you can be sensitive to these people, but you would need a lot of hand holding with the professionals to how to deal with this kind of situation. Make sure that you tell them that they can get the support that they want, how are they feeling, be around that part of it. Tell them that they can, if you can facilitate, ask them to talk about it, what are the concerns for them, because they take a lot of time to open up and talk about their concerns.